Hello everyone, NutriTalk with Eva. My name is Eva Lane. I'm back again for today I'll take you through hypertension, which is also called high blood pressure. And high blood pressure is a silent killer. It can be prevented using nutrition tips if you follow. So I take you through hypertension today and their management and foods to avoid and foods to take. So hypertension, mostly it affects the adults and the old people, and then to some extent you may find a diabetic patient having hypertension. For cases, it can't affect children, but mostly adults and the old people. It have their causes. Hypertension is caused through eating a lot of salt. It can also be caused through genetics, obesity, lack of exercise. When you take a lot of salt in your food, you probably have hypertension, because hypertension say we limit salt intake. The iodine, it's limited. That's why when you take a lot of salt in a while, you probably have hypertension or other cardiovascular diseases. Hypertension is one of the cardiovascular diseases. It affects the arteries. And and so I took you through. I wrote some notes here so that I can take you through it. And one of it, I want to show you to know that you have normal blood pressure or high blood pressure. I don't have the machine here, but I'll read for you. So for normal blood pressure, it should be 120/80. That's normal, the normal one. Then the upper one, the 120/80, the 120, the upper one is known as systolic, but the lower one is called diastolic. It's the lower one. Then we have pulse rate. Pulse rate should be 60/80 beats per minute. That's how your heart is beating. Okay, it should be 60/80. And then when you see your blood pressure is 90/60, that's low blood pressure. And if for example you may find a patient having blood pressure of 140 maybe over 115. So what we do, we recommend them to take adequate water. We drink a lot of water, and then we repeat again, so that we know whether the pressure will decrease. There's some of the symptoms to know that you have blood pressure. Then one, headaches, severe headaches, dizziness, and blurred vision. Blurred vision is when you feel like you can't see well, of which blurred vision, it also affects the diabetic patient. Okay, today my concern is hypertension, but hypertension and diabetic, they are like friends. They are like brothers and sisters. That's why I'm discussing hypertension with a bit of diabetic, because some of the things are in diabetic. Okay, so people are asking about Himalayan salt. excessive salt and asking whether, oh, nutritionist, can I take this? And I told them no. Himalayan salt, you can't take it because it have a lot of sodium. And here, our case, we are trying to limit salt intake, okay? So, I tell you, no, don't take Himalayan salt. You should take the fortified salt, but a limit was sparingly salt. Don't take raw salt, but cooked salt. Don't add salt when your food is already cooked. Just adding there, like for the Kikuyus, when the githeri is cooked, unachocha, unaweka chumvi. The salt is not cooked, it's raw. You say, try not to take a lot of salt. I hope you understand. So, I want to take you through the management of hypertension. So, there is something called DASH diet. DASH diet is for the hypertension patients. It consists of fruits, vegetables, lean proteins, fortified foods, everything that is fortified cereals, fortified bread, fortified flour. You see? Yes. For hypertension patients, they should take a lot of vegetables, a lot of fruits, the fiber fruits. Fiber fruits such as apple. That's one of the fiber fruits. We have banana. Okay. Then another thing about hypertension, if for example you are a man and you take alcohol, we recommend you to limit intake of alcohol. Yes, definitely. Maybe you take a lot of alcohol, like maybe not occasionally, but every day you take alcohol and you have hypertension. What should you do? You should limit intake of alcohol. Maybe to take 3 glasses, you can limit to 2. You can stop at once, but you stop slowly but slowly. Another one is stress management. Yes, the economy is bad and all that, but you should you should manage your stress. Yes, you don't have money, you want that shoes, you don't want. Manage your stress, it will help. Then hydration. You should take a lot of water during the day, 2 to 3 glasses of water. It helps. Hypertension, it goes hand in hand with drinking a lot of water. Another one is to avoid the fatty foods. You should avoid the fatty foods. And I repeat again, limit the salt intake. You should limit your salt intake so that you can prevent and manage your hypertension. It will help so much. And another thing is exercise regularly. You should do exercise. Maybe you can just walk like for 30 minutes. You can skip ropes. Hypertension needs a lot of exercise. You should be free. And then your diet should be well. Healthy diet, it's your wealth. Your health is your wealth. Health is luxury. You may not have enough money, but you are very healthy. There's nothing bothering you, like you're not stressed out with some diseases. So that's all about hypertension. And thank you for watching. Don't forget to subscribe, comment, share for more and more management of diseases, about nutrition tips. Little Talk with Evelyn. My name is Eva.